During the early postnatal period, we aim to provide the best possible care to you and your baby to assist with the smooth transition to parenthood. If you have had a home birth, the midwife will stay with you until your baby has fed and you have passed urine. If your baby was born in hospital, the length of stay can be from 3 to 48 hours. The amount of time you will be advised to stay will depend on the type of birth you've had, your recovery, and how well your baby is feeding. The midwives will discuss your transfer home to the care of the community midwife. Please ensure you give the hospital staff the correct address and phone number for where you are going home to and the correct details for your GP. Whilst in hospital, we suggest you get as much rest as possible, eat and drink well. Please take any medications prescribed for you and continue to take them at home if necessary. Do not hesitate to ask if you need further information about taking medication. Your personal hygiene is essential in the postnatal period to keep you and your baby safe and well. All women should wash their hands both before and after changing their sanitary towels to reduce the risk of infection. We ask that your family and visitors respect the visiting hours to ensure that mums and babies get as much rest as possible. Contact numbers for your midwives are in your handheld notes, together with emergency numbers should you need them. You will be advised of the frequency and location of your postnatal checks. If you are being seen at home, the community midwife can visit any time between 9 and 5, including weekends and bank holidays. They cannot specify what time they will get to you due to the scheduling of their clinics and other work demands. The community midwife will see you the day after you come home and will ask about your health, how you are feeling, and give appropriate advice. During postnatal visits, the midwife offers examinations to assess you are well and recovering from the birth, both physically and emotionally. Your breast may become full and possibly uncomfortable a few days after the birth, and this is normal. However, a painful, hard, red patch on your breast and feeling unwell with a high temperature or flu-like symptoms can be a sign of mastitis, and you need to seek advice. The numbers for this are in your handheld notes. The midwife will palpate or feel your uterus to assess that it is returning to normal after your pregnancy. You will be asked about your blood loss, which will normally continue for between 2 to 6 weeks after the birth. If your blood loss suddenly becomes very heavy, it is important to seek urgent medical care. If you experience abdominal pain, offensive smelling blood loss, develop a temperature, or are passing clots, please contact your midwives or seek medical advice. The midwife will ask if you are passing urine normally and whether you are having your bowels open. It can take up to 3 days for you to have a bowel movement after giving birth. If you have had stitches, these should be examined regularly by the midwife, as you may not be aware if they are not healing properly. You will be asked to look for any pain or swelling in your legs, which could alert us to the development of a thrombosis or blood clot. This is a complication which needs urgent medical advice. It is not unusual for the baby's skin to become a little blotchy, red or dry, and we advise using plain water on the skin for the first month of life. It is not unusual for a baby to develop jaundice. The skin and whites of the eyes may look yellow if this happens. The midwife will assess the baby and decide if the baby needs to return to the hospital for further investigations or treatment. Frequent feeding taking place at least 8 to 12 times each 24 hours helps to minimise jaundice. If the investigation shows that the jaundice level is high, the baby may need phototherapy treatment with ultraviolet light. The baby's eyes and mouth will be checked to ensure that they are healthy. The midwife will check the baby's umbilical cord to ensure the clamp is secure and that there are no signs of infection. The cord will normally separate around 8 to 10 days after the birth. The midwife will undertake a feeding assessment and will be able to assist you with your chosen method of feeding. Signs that the baby is feeding well are frequent wet nappies and stools that change from black tarry meconium to brown and then yellow by day 4. If breastfeeding, the stool is often a runny consistency and more solid when artificial feeding. The midwife or maternity care assistant will see you and your baby on day 5 to repeat the examinations previously described, plus weighing the baby and taking the newborn screening blood spot test. Most babies will lose weight in the days after birth, and we will check that weight loss is within normal limits. Some babies may be back to their birth weight by 10 days of age. You will also see the midwife when the baby is 9 or 10 days old. The midwife will repeat the postnatal examination as before and weigh your baby again. Postnatal exercises, registering the birth of baby and contraception will be discussed along with any concerns you may have. If all is well, care will be handed over to the health visiting team.